Hi, my name is Dr. Jason Felger. I'm one of the Cardiothoracic and Vascular Surgeons here at Shannon Hospital. I'm here to share some advice and some instructions on what you may experience post-operatively at the hospital, as well as some care instructions that may be helpful for you and your family when you get home. While you're in the hospital recovering from your operation, you'll be asked by the nurses, as well as some of the respiratory staff and physical therapy staff, to perform some duties that will improve your recovery after surgery. You'll be ambulating 4 times a day, 10 minutes each time. This is to improve your lung function as well as to prevent any kind of clotting in your legs. It will be beneficial in your recovery and you will show slow progression while you're recovering from your surgery. Another thing you will be doing is pulmonary exercises to improve your lung function, to keep your lungs clear, to try to prevent any type of pneumonia. We will be getting you up out of bed for every meal. You don't eat in bed at home, you're not going to eat in bed at the hospital. You will also be taking a shower once a day. Even if you have your dressings on your chest from your wound, you will be taking a shower every day. Those are all about getting back into the normal routine for when you go home. There will be 2 really important things that you're going to learn after surgery. One is you're going to be on some fluid restriction. After heart surgery and even after lung surgery, we're going to be limiting your fluid intake on purpose so that we can get rid of the fluid that we gave you during the operation and that you accumulated after surgery. This is a normal process. Your weight will be elevated. That fluid will slowly be taken off with diuretic therapy. And if you keep on drinking more than what you're urinating or what's coming out, then we're not going to make any progress. So we will limit how much you are drinking. Another thing, you're going to be educated very well on your medications on a daily basis. Even when you're walking with the cardiopulmonary tech, you're going to be talking about your medications and why you're taking them and why it's important to take them. Those are all very important things that you're going to be learning and your family is going to be learning while you're there in the hospital recovering after your operation. So after you have fully recovered from your operation in the hospital, we will also be going over instructions for what you need to do at home. You will be continuing to walk 4 times a day, 10 minutes each time. I don't care how far you go. I don't care how fast you go. I don't care where you go, as long as it's a continuous 10 minutes of walking 4 times a day. That's the same reason, to keep your lungs clear and to keep your legs moving and to keep you from building up any clots in your legs. That's going to be very important for you to continue. Furthermore, you're going to continue your pulmonary exercises. You're going to be using that same machine you had at the hospital called the incentive spirometer to measure how well you can take a big deep breath. That's going to keep you from developing any kind of pneumonia at home. It's going to be real important for when you're sitting at home watching TV, you keep on using your breathing machine every time commercials come on. You take 2 good deep breaths every time the commercials come on. You're going to continue to shower every day. Even if you have your dressing on, you're going to continue to shower with that on. That dressing will come off on the 7th day that you're at home. So you'll take that off on your own and then you'll continue to shower with that dressing off. You're going to keep taking your home medicines. That's going to be very important. We're going to talk about your home medicines when you leave. We're going to tell you what you need to take and what you don't need to take and the reasons why. But those medicines for that first 2 to 4 weeks that we have you prescribed for are going to be very important for you to take. You're going to weigh yourself every day. You're going to have a little ledger where you're going to have a date and a time. You're going to have a weight, a heart rate, and a blood pressure all written down. And each day you're going to weigh yourself in the morning. You're going to take your medicines in the morning after a small meal. You're going to take your blood pressure and you're going to take your heart rate and you're going to write that down every morning. Some people will take your heart rate and blood pressure also in the afternoon. This is all going to be written down so that when you come visit the doctors, we're going to know what your blood pressure, your heart rate, and your weight are so that we can adjust your medicines accordingly. Once again, you're going to be on the fluid restriction. We're going to teach you what you can and can't drink and how much you can. This is not going to last forever, but for that first 4 to 6 weeks after surgery, it's going to be real critical we monitor how much fluid you take in. Also, you're going to be given an appointment for your primary care doctor to see you within 7 to 10 days. And if you don't have a primary care doctor, we're going to have you scheduled with urgent care. You're also going to have an appointment scheduled with your cardiologist. That's going to be usually in about 2 weeks after discharge. And then you're going to have an appointment with the surgeon, either myself or one of my partners, in 4 weeks. All of these are on purpose to be scheduled in those intervals so that we can see you in a regularly scheduled time and adjust anything that we need to adjust. You're not sick enough to be in the hospital, but we're not ready to let you just go wild into the wilderness. So we're going to monitor you for these first 2 to 4 weeks pretty closely. You'll also be given phone numbers to give us a call if you have any problems. Someone's always on call in my office 24/7. But all of these appointments and all of these instructions are very important to follow, especially that first 4 weeks after surgery and after your discharge from the hospital. I want to personally thank you for trusting us with your cardiac care here at Shannon Medical Center.